My name is Nick Andrade, and I'm a neurosurgeon at CHRISTUS Trinity Clinic. I grew up in Dallas, and my parents were around a lot. I was very fortunate to have them and their attention growing up. I'm happy to be in Tyler with a calmer lifestyle, an easier lifestyle, but I really enjoyed growing up in Dallas. I would say my parents have. My mother grew up in Teague, west of Palestine, and her father worked on the railroad there. And she really pushed me growing up, and didn't settle for anything less than what she thought I was capable of. My father grew up in Dallas and was very well-traveled, well-read in several languages, and inspired me to kind of be curious and intellectually active and independent thinking. So the combination of my parents, I think, made me who I am. I broke my leg when I was 15 in high school, and that first got me interested in medicine, and I volunteered at Parkland Hospital in Dallas and got hooked, and realized that the training was long, especially to be a surgeon, and so I decided to get through high school and college early and kind of get started, get going. Going back to, I guess, when I was when I first kind of spent time with the neurosurgery team as a medical student, I think seeing people come in, say, with a severe brain injury, nearly dead, comatose, and then seeing them walk out of the hospital a couple weeks later and thinking that at least in part that was you contributed to that, was a very satisfying thing. So I felt like I was doing important work. My wife and I knew we wanted to stay in Texas, and we were looking for kind of good places to raise a family, and Tyler stood out. And since having been in Tyler, I think that I was impressed with CHRISTUS Trinity Clinic's integration and the high quality, and then also I think the commitment to electronic medical record, and I think the dividends that can pay long-term with integration of care for patients also stood out in my mind. I think most physicians try to live by the golden rule of do unto others as you would have them do unto you, and that certainly is a guiding principle for me. I think in terms of key mantras that I try to keep in mind when taking care of people, keep it simple, stupid. Kind of know what your purpose is and be very clear in what you're trying to accomplish. Measure twice and cut once, and have a good, clear plan when you're going in, because it is high stakes. I'd say I'm relatively unique among neurosurgeons in that I've taken care of my father with a malignant brain tumor. I don't know that it makes me any more qualified to take care of patients with brain tumors, but certainly I have a better understanding and can relate with their experiences more than I could before.